Welcome back. We're so glad to have you back with us. And I have another guest, another outstanding guest, and this is Shelley Poirier. And we're going to find out all about what Shelley is all about and what she wants to tell us about this evening. So Shelley, welcome to the show.
Thank you. I'm glad to be here.
We're glad to have you here because when I spoke to you some time ago, you were explaining to me what you do. And I got so excited about this, I said, look, I want you on my show. And you said, okay, and we had to book it way in advance. It was a long time ago. But, so to reiterate it for me and for our audience, I need you to tell me, okay, Shelley, what is this Living Free all about?
Okay. Well, Living Free Health and Fitness is, it's a 501c3 nonprofit corporation.
Okay.
It's a public charity. Our focus is really on helping people stay stopped. In other words, stay stopped from addiction.
Okay.
So
Which addictions?
Well, substance addictions and also behavioral kinds of addictions as well. Yeah. I think our primary focus is on substances because that seems to be sort of the bigger problem for folks. And so toward that end, what we initially started to do was to engage the community in opening 2 sober living homes.
Oh.
So we have a women's sober living home and we have a men's sober living home.
And where are these located?
They're here in Pahrump.
Okay.
And the concept behind that is they're now state certified as transitional living. But the program is about them getting clinical help as well as the structure and supervision that's important to kind of getting their lives back together.
Okay.
And avoiding poor choices.
Yep.
Helping to avoid impulsivity, learning to delay gratification, and get their confidence back and rebuild that self-esteem.
Okay. And who are the professionals that help them accomplish this?
Well, I'm a licensed alcohol and drug counselor and a supervisor of drug and alcohol interns and a master addiction counselor. So there's me, and then I have other staff as well who are certified and licensed.
Okay. You know, we talk about addictions and all the other things. How about the opioid crisis? Can you tell me your perspective on that?
Well, there's a lot of, you know, it's in the news a lot these days about the opioid crisis. And obviously there are a lot of deaths related to that, and that's a huge problem. But the drug addiction problem is a big problem in general. I think that with the overdose deaths these days and with the fact that drugs like fentanyl are being introduced into, obviously, the opioid-based drugs, but they're also put into counterfeit drugs like counterfeit Xanax, or they're put into, it is put into methamphetamine and cocaine. We're seeing even more overdose deaths than you might imagine.
You know, all of this is sad to hear. Where does Nevada fit in this range of all problem area?
Well, according to the CDC, Nevada ranks 24th in opioid-related deaths, which is terrible. But even worse is that Nevada ranks #1 in methamphetamine-related deaths. #1.
Wow.
Yeah.
How many deaths are we talking about? Even one is too many, but how many deaths are we talking about?
Well, related to the opioid crisis, the deaths nationwide was about 64,000 last year.
Just think about the waste of all the talent that we've lost because of this.
It is terrible, and the real problem, I think, is a lot of people do stop using drugs. There's some intervention that happens where maybe they're picked up by law enforcement, or their family encourages them to stop, or they just get sick and tired of it and they stop. But the real trick, if you will, is staying stopped. Is how do you get people to stay stopped? How do you get them to remain abstinent for a long enough period of time that they're able to engage the habitual changes that need to take place so that they can start to live life in a new way?
That's got to be the challenge. And obviously those are the things that you're working on. What kind of successes are you having?
Well, I would say since we've gotten to Pahrump, we've been very successful. We arrived about a year ago, and we've opened 2 sober living houses.
Okay.
And we have office space at Mesquite and 160, 2,400 square feet of office space.
Great, okay.
So we've become SAPTA certified, which is the Substance Abuse Prevention and Treatment Agency in the state. So we're state certified, prevention, intervention, outpatient and intensive outpatient, as well as our transitional houses. And we're certified for adults and adolescents. Not the transitional housing, that's adults only.
Okay.
But yes.
Now, it's not something we've talked about, but I have to ask the question just because I want to know.
Mm-hmm.
How does this relate, and how do you work with the Nye County Sheriff's Office and maybe even the Federal Detention Center?
Okay. We've made a proposal to try to bring treatment into the jail. We'd like to do that, and that's sort of in process somewhere.
Okay.
I've spoken with the powers that be there, and I think it's something they're interested in doing.
Now, is this the Sheriff's Office or detention? Or
That
the
would
Federal
be the Sheriff's Office.
Okay.
And as far as the detention center is concerned, since April, I've been bringing a weekly class into the women on a particular unit there.
That's the Federal Detention Center.
Yes, the Federal Detention Center.
Okay.
And I've spoken to Warden Kane as well about the potential for bringing programming in, more formal programming,
Okay.
more frequently. And again, law enforcement is very open-minded to it. It always comes down to what? Money, right?
Yes, yes, okay.
So, yeah.
You know, with all the things that you're trying to accomplish and all the things that you're accomplishing, that's why I wanted to ask about the success rates. But we know too that suicide falls in there somewhere. So how does that relate?
Okay. Well, unfortunately, suicide, for people who use drugs and alcohol, the success of suicide attempt is 6 times higher. So people who are using drugs and alcohol have a 6 times higher suicide rate than the average or typical population. And a lot of that has to do with the fact that when we use psychoactive substances, it does suppress our delaying gratification. We are more impulsive when we're under the influence, and we have a lot less inhibition. So it makes it easier to complete such an act, or even, I guess, consider it in some cases.
Wow. Okay.
And I think that that's a very important piece of why we're focusing a lot on helping adolescents as well, because we have had adolescent suicides in this town in the last year, which is just unfathomable, unfortunately. And I don't know the circumstances behind those necessarily, whether drugs or alcohol were involved, but obviously one death is too many.
Definitely.
And if there's a higher propensity for suicide under the influence, we want to make sure that as many people as possible, adolescents or adults, that we can stop that addiction and that substance use.
So much you're trying to accomplish, and like you said earlier, you've got some successes. What about people in recovery? How are they doing?
The people in our sober living, for instance?
Yes.
They are doing outstanding. I could not be more proud of the men and women who are in our homes right now. We have had people who've come in who were maybe not ready, or other circumstances kind of had them leave, let's just say. And that's always the way it is in recovery. I know I had my own false starts. I'm in recovery myself, and my sobriety date is September 5th, 2001. And I know I had a number of false starts, so it's not a judgment thing or anything like that. But when people start to get to that point where they're ready, I think that the homes that we have for people afford them the greatest chance of success and support.
So by being in recovery yourself, you understand what they're going through.
Absolutely.
Okay.
Absolutely. It is not easy. It's the hardest thing maybe that you'll ever do in your entire life. But we bear personal responsibility for our sobriety. So
I like the way you say that, because you have some people that say, well, I can stop drinking whenever I want, or I can stop using drugs whenever I want, or I can whatever. And whenever I want, well, how do they determine when they want? That's always the tough part. But like you said, it's not easy. But once you recognize, look, I have a problem, I want it to end, then it becomes, like you said, I've accepted it. It's my responsibility to make this happen.
That's true. I think that, yeah, and how does someone determine whether they're ready or not? A lot of times they do say they want to stop, but they kind of want to do it on their own terms.
Yes.
So that in general doesn't work in the end. It may work for a short period of time, but it does not work in order for them to stay stopped for good. And so what we try to encourage people with our clinical and with our the practical things that we teach them in the house about eating right, we get them gym memberships, they go to the gym, they're supposed to work out at least 3 times a week, they need to get jobs, they need to do service work, they need to re-engage in the community and with their families, and if they have legal obligations, meet those legal obligations. And learn to, stop kind of with the excuses and get with the honesty.
You got to face it before you can even talk about getting rid of it. If you haven't faced it, then all you're doing is just feeding yourself a false line that, hey, it doesn't really happen.
Right, absolutely. And so I think that when are people ready to recognize that they're ready to stop? Of course it's different for everybody, and different people have different bottoms, if you will. So and it's hard to guess. Sometimes you can really get a sense of, okay, this person's ready. Like as a clinician, I can see that a lot of times, and other times people, I have my doubts about it, and they surprise me, and I love being surprised. I will tell you that. Nothing better.
I can imagine when you see all of a sudden somebody that, hey, they're not ready, and all of a sudden you find out they are. That's fantastic. Well, it sounds like you're on the right track to everything. I know we're gonna say more in the second segment because there's so much more to cover. So we want you to come back and join us. Don't miss any of this because it's very important.